Hello, everybody, and welcome to another episode of the Serdentity podcast. I'm your host, Elizabeth Dewar Anthony, and I'm so happy to be here. And today I have my very good friend and fellow professional, Dr. Paul Henny, who has an office in Roanoke, Virginia, that I've been to. It's quite lovely. And he is the founder of the Bob Barkley Study Club. And he is all about patient centered care. And he and I are definitely simpatico as far as that goes. So I wanted to have him on so we can talk about it. So, hi.
Hello and good morning.
Good morning. Oh, it's noon now.
Well, it is. It was a couple minutes ago.
It was a couple
Morning.
minutes ago. So, patient centered care. So, Serdentity, serene and dentistry. And when I bring serenity into my approach, I have a more serene interaction with the people that are in my care. And that is patient centered care. You can call it whatever you want, but my focus has always been whoever is in my chair at that moment and what I can do for them to help them have a better experience. And when I do that, we both have a better experience.
Yes.
And I learned when I started studying myofunctional therapy in the airway that dental trauma starts because people can't breathe. They can't breathe in the dental chair. And so they're coming in to the office expecting to not be able to breathe in a defensive posture and a defensive mood. And
Mm-hmm.
they get, the dental professional reacts to that defensiveness, and then everything goes to where and what. So let's talk about it.
Okay. Let's talk about serenity. How do we achieve more serenity in the dental office? Well,
Mm-hmm.
my suggestion is that we get more and more in alignment with what people want and what people expect. Therefore, they're not going to be afraid. They're not going to feel threatened. They're not going to be in a defensive posture, all the things that you've talked about. And to achieve that from one person to the next is a very individualized journey.
Mm-hmm.
Some people may come to the office with nothing but positive experiences with with previous dentists and dental hygienists and other people involved in dentistry, and philosophically they're in alignment with what you do, and you just the first few minutes you click and you're able to collaborate and get a lot of productive things done without a lot of side discussions or apprehension or all the other things that can go along on the negative side of things. Then on the other end of the spectrum, we have people that have history of trauma
Mm-hmm.
associated with dentistry, and that could be a broad spectrum of things that they may or may not be ready to share with you yet.
Yes.
So some people may be very, very forthcoming about that. Other people's may not trust you enough to even be able to tell you what their concerns are. So this means that really we need to focus on developing a more of a personalized relationship with everybody.
Mm-hmm.
This runs in smack dab into the face of the broad industrialization of dentistry that's occurring right now. So
Mm-hmm.
as in fact, a post that I put up on the Bob Barkley Study Club this morning about how much more production you have to do when you
Yes, I saw that.
discount your fees X amount. At the end of the day, what that means is you've got to leverage economy of scale. If Delta Dental or some other insurance company reduces your compensation 15 or 20% suddenly, where is that money going to come from? How are you going to compensate for that within your business model? Well, the only two ways to do that is down delegate the tasks. So you
Mm-hmm.
add in more hygiene assistants, or you delegate more work to your clinical assistants so that the doctor can room hop more often.
Mm-hmm.
You can see more people per hour, and by seeing more people per hour, you can attempt to compensate for that income loss. You of course pay for that in degradation of the quality of the relationships you have with people. You pay for that in stress and strain on your body and your mind. It shifts the focus of the practice away from patient-centered care towards production-centered care.
Mm-hmm.
And so everything starts to revolve around the insurance model, and what the insurance model, the mother of all income, what do I have to do to entice the insurance companies to pay me for what I'm doing?
Mm-hmm.
So that becomes an Alice in Wonderland rabbit hole that everybody chases after endlessly, and people have made long careers off of teaching other people how to address that and
Mm-hmm.
try to fix it. But at the end of the day, it's it the outcome is diminishment of the quality of relationships that we have with people,
Mm-hmm.
and that is most relevant when we're dealing with people that have complicated problems, layers of problems, layers of symptoms, one thing affecting the other.
Yes.
And so we can't even begin to get people to reveal the kinds of things that they're struggling with and sharing with us openly and honestly, unless we've built in a very conscious way,
Mm-hmm.
structured the nature of our relationship to be supportive of trust and open and honest communication. Because resolution of complicated problems versus, removing calculus from a teeth or fixing a
Mm-hmm.
small hole in a
Mm-hmm.
tooth, resolving complex, often multi-system problems, holistic holistically influenced problems, that requires the person to be a co-therapist. That means that we can't do health to them.
Mm.
That means we can't be the almighty doctor or the almighty hygienist or the almighty whoever, and just by proclamation and subscription and prescription and command expect the outcome that we want.
That, yes, that authoritarian practice model, it absolutely doesn't work for people who've been traumatized, and they're going to push back on that, and that leads again to that. Then you get into a power struggle, and even well-meaning professionals, the patient's perception of what is happening is what matters to them, and what the patient perceives and what we're trying to do might not. I mean, they might be like this, and so that authoritarian approach, I find, just does not work with people
No.
who are coming in trauma.
So it tends to, and there are parallels to this in all other, health professions. But, you get into those situations, it tends to drive people away for a number of
Mm-hmm.
reasons: fear, shame, whatever, cost,
Mm-hmm.
because even cost, because they can't get their head around the cost of it and the time
Mm-hmm.
it might require. Since they can't really process that easily, they just put it to the side and say, I'll deal with that tomorrow.
Mm-hmm.
So that's often the time that we're initially dealing with a person where it's something they put off for such a long time has reached an acute point at which they've got to have somebody help them in some
Mm-hmm.
way.
Mm-hmm.
And of course, our nature as highly skilled and trained professionals is to kind of frown upon them and, oh, why did they do this? Why did they wait until Friday afternoon to call me up about this
Mm-hmm.
toothache they knew about all
Mm-hmm.
week? Blah, blah, blah. I'm about ready to go on vacation. So we get into this pattern of thinking disparagingly about people when really they're just like us. They,
Mm-hmm.
but they haven't had a successful collaborative relationship with a dentist in this particular case. And I think my personal opinion is that's my profession's fault. We have, to a
Yes.
large degree, created that
Yes.
psychological ecosystem that tends to run off people that need the
Yes.
help the most, right?
Yes.
So, so there's a certain amount of soul searching that needs to go on if, if our agenda truly is to be health centered and health promoting
Right.
and helping versus just, making enough money so I can get that new boat that I've really been checking out lately on the internet.
Mm-hmm. Mm-hmm.
So it depends on where your priorities lie and why you went into healthcare in the first place. And my perception of most healthcare professionals that I've met in dentistry is that almost all of them went into dentistry for the right reasons. Then they
Mm-hmm.
got stuck in dysfunctional systems of their own creation or of somebody else's creation where they didn't have the power or authority to change it. And it just kind of broke their will and they just
Mm-hmm.
became slaves to the machine. And monetary compensation became the only thing that really gave them any amount of dopamine, if you know what I mean. So,
Wow.
otherwise it's all negative. Everybody comes in and complains about how much they don't want to be there and how much they hate to be touched or this or that.
Mm-hmm.
And I mean, that has a cumulative effect on the psyche of every dentist and dental assistant and whoever in the
Mm-hmm.
practice. And it becomes an us versus them mindset. And then it becomes a game on how can I manipulate this
Mm-hmm.
person to do the thing that I want them to do so that it's least traumatic on me. And that might be to sedate everybody.
Yeah.
That might be, there are a bunch of end arounds for that. The hardest thing to do is actually sit down with a person and get to know them and work through their fears and phobias. And that just happens to be something that I've done for a long, long time. I've always, my practice has always been relationship based. And can't count the number of people that I've worked through their fears and phobia that have become fantastic at self care and
Mm-hmm.
self management.
Mm-hmm.
When in the very beginning, the conversation may have started out with them crying and barely able to tell me what's wrong or why.
Mm-hmm.
And to eventually, months or even years later, they're actually actively participating as a co-therapist in the maintenance and repair of their health. So, there it requires a different practice model. It requires a different mindset. It requires a different compensation pathway. It requires greater awareness of other systems that we haven't considered before, like
Mm-hmm.
airway,
Mm-hmm.
and how one is influencing the other, and how simplistic approaches aren't gonna get you there. So, people like David McCarty help open our eyes to these kinds of things. People
Mm-hmm.
like Emily Stein help us look at it from another point of view entirely. So we as health professions have a strong obligation to expand our knowledge set out to the point where we can see the bigger picture, both on a physical, microbiological, physiologic, psychological level, that we can deal with the whole person.
Um, I gave my talk, Roots of Dental Trauma, at the end of June to a group of general dentists. And my bottom line message to them is whether you know it or not, you are working in the airway. We work in the airway, and you have to understand how vital that is to the patient is going to survive. The patient's brain is going to survive no matter what. So if they're somebody who's a mouth breather, which 99% of people are, and you're trying to do some work in their mouth, their brain is not having it. And one of the principles of Serdentity is this: to not personalize. I in early in my career, I took it very personally. I would have a rough day because I would be dealing with these people who weren't appreciating what I was trying to do for them. And at the end of the day, even though I treated them, nicely, I would be seething with resentment and exhausted, and take it out on my family. And one of the big changes I made personally was to stop taking it personally. These people are reacting to their previous dental experiences, and and I have to meet them where they're at.
Right. Now, as a dental hygienist, you're in a less powerful position, let's say, than a dentist, particularly a dentist that might own a practice and have the power and authority to manage every aspect of it. So, which is a whole nother conversation. But
Mm-hmm.
if you own and operate your own practice and you're unhappy, you need to just go in the bathroom and look in the mirror because you
Mm-hmm.
are the creator of the systems that you don't like.
Mm-hmm.
And that's a hard pill to swallow. It's easy to blame shift and, just say, people in my town just don't appreciate the kind of dentistry I can do. And
Mm-hmm.
I'm going to move. I'm going to move to the suburbs. I'm going to move someplace, some magical place where everybody's
Mm-hmm.
going to automatically appreciate me. In fact, they may even bow down when I come in the front door. But you can have those fantasies, but the reality is you can't, it doesn't exist. It doesn't exist. Now, on the other end of that spectrum, there are people that we can't work with. There are people that behaviorally, values wise, priority wise, whatever, they are not close enough in alignment with what we do and do well and want to do and focus our time and energy on. Um, that we are truly wasting our resources trying
Mm-hmm.
to help them. So,
Yeah.
you're familiar with the Pareto principle, the 80-20 rule. I think the most successful way to run a person centered health center practice is to focus on the 20%, who are the
Mm-hmm.
people that are most closely in alignment with what you do and value it highly. Then you're not in conflict. You don't have to spend as much
Mm-hmm.
time talking people into why this is important. They see it because it's kind of already part of their sphere of
Mm-hmm.
understanding. So, as a hygienist, for instance, you're often put in a situation where you're working in a practice where you don't have a lot of control over who's coming in and out of your room.
Mm-hmm.
And the dentist, if they're significantly involved with the insurance scheme, they don't have a lot of control over who's coming in and out of the door
Mm-hmm.
either. And that's a tough riddle to solve, I think. And which is another side conversation is are there ways to get a practice under control when it's heavily involved with insurance? I'm sure there are. I never figured out how to do it. I'll just put it that way.
Um,
Um,
I'm sorry, go ahead.
so you've got to this is a decision for every dentist to make. What's the purpose of the practice and who's an ideal patient for that purpose, and how do we find more of those people? How do we support them and develop them? And how do we identify the people that aren't well aligned with that purpose and to kind of move them out of the picture one way or the other so that we can invest the limited resources we have. We only have so much time, energy, and money in a day and in a week and in a year. Who do we want to focus our time and attention on to render out our purpose at the highest level possible? So these are all important, sometimes challenging decisions for dentists to make because they get stuck in debt and
Mm-hmm. Mm-hmm.
situations in side practice models they maybe didn't choose or want, and they're beating their head against the wall every day. And you just get on the internet and any of these social groups on Facebook and other
Mm-hmm.
places, and boom, there it is, just people vomiting how miserable they are in
Yes.
their practice situation. And
Mm-hmm.
and the natural reflex is to flip it, just like say flip it around and blame shift it on the patient. But as I said, oftentimes it's the person in the mirror that's really, if you want to look multiple steps back, why that happened. Why did that happen? That was because of multiple decisions that I made, maybe in the very beginning, to continue
Mm-hmm.
working with this person or whatever. And it culminated in this conflict that ruined my day and my night
Mm-hmm.
and my sleep and all kinds of things. So, we have more control over these situations than we really want to acknowledge.
I've had the experience that you described of working in an office where it was, heavily insurance dependent. And I've even worked in, Medicaid practices, which in where I live, there's virtually no such thing as a private practice that takes Medicaid. And it's interesting, the further you go down the socioeconomic scale, of course, the worse the health and the higher the trauma in
And the higher the need.
yes, and the higher, yes, that and people come in. But I have to say that my attitude has been the difference. And I've had, even in those circumstances, been able to, to touch and have great experiences with people in the limited amount of time. And with all this chaos going on out here, I've still been able to do it. So you're exactly right. It's an inside job.
Right. So socioeconomic status has nothing to do with values per se. So you can have somebody with a very high value for health, but low capacity to pay for it.
Mm-hmm.
And so you're going to find those people everywhere in
Mm-hmm.
every kind of practice. And so that likely means that you're going to have to start out with, a very basic care phase one sort of a strategy with the person until you they can get to a place where they can afford to do something more sophisticated than that, which is, at its essence, why Bob Barkley developed the systems that he did. The majority of his patients were kind of in some situation like that. They weren't able to accept a big, elaborate, sophisticated, comprehensive restorative treatment plan the first time they met Bob, much
Mm-hmm.
the less value it.
Mm-hmm.
So he understood psychology better than almost any dentist I ever read about or learned about. And he said, develop your relationship first. That's the important thing. Then do the dentistry. Focus on the quality of the relationship, which over time will render out better and better decision making.
Mm-hmm.
And to put the burden on the patient to have to make all these big, expensive, important decisions, the first time or two that you meet them, I think is very unrealistic in most cases,
Mm-hmm.
unless the person has come to you highly referred and they're ready.
Right.
They've done their research. You're the one. They're ready to pull the trigger. How
Mm-hmm.
does, most people are not in that situation. That comes later after you've developed your practice and developed your brand and you developed your referral sources, and then more and more of those people come to you ready.
Mm-hmm.
But in the beginning, that's not the case. In the beginning, most people need to be developed. They need to deepen their understanding of what's happening to them, why it's happening, what the trends are, what the implications of those trends are, how they feel about that, what they want for themselves over time. What are they willing to do now to change the course of that inevitable outcome? Those are some pretty significant conversations to have with people. That's not happening in 5 minutes in the hygiene room.
Right.
Sorry, you know?
No, it's just not. And I'm thinking right now about you and Dr. Stein and the what you guys are coming up with. That's so important. That's really the first step, right? Let's get that microbiome where it's supposed to be. Let's not worry about the holes in your mouth. Let's worry about the biome. Let's,
Right. So basically, what's the one thing that each person could do for themselves to stop the progression of their disease state or states? It's to get their microbiome under control and managed.
mm-hmm,
And Bob Barkley used to do that by literally, he would not restore. If somebody came into his practice, and we're talking about, the 1960s here and the early 70s, And he lived in a small farm community, maybe 12,000 people. Most of them weren't very sophisticated about, the best that dentistry could do for them.
Mm-hmm.
More, a lot of them were just farmers out in the community or worked in businesses that supported the farmers or, were working at the university in some capacity. And back in the day, people that used to work in universities weren't making $350,000 a
Right,
year.
right.
So it was a different time and a different place and a different mindset. And he would oftentimes, if the patient was compromised with regard to their ability to pay for things, he would just, it was a significant cavitation in a tooth, he would just open it up so that the patient could self-cleanse it better with a toothbrush.
Wow.
He would not fill it,
Wow.
particularly if it was a child.
Mm-hmm.
So there was no rush to go in and repair everything fast. The focus on the front end was effectively getting the microbiome under control. So at that point in time, that involved fluoride, that involved flossing, that involved improving brushing technique and all those things. And
Mm-hmm.
then a 5-day program where people could kind of self-observe how their body was healing
Mm-hmm.
from what they were doing, not what Bob was doing, but what
Mm-hmm.
they were doing. Bob's technique was to allow each person to experience self-empowerment.
Wow.
Self-empowerment then causes the person to realize, hey, maybe I can manage all these complicated problems. Maybe it is worth it to me to make some sacrifices in other areas of my life so that I can afford to do X, Y, and Z and get my mouth healthy and stable so that I don't have to end up like my mom at age 45 and have all her teeth taken out and wearing dentures and then hating it every time we get together to try to eat together.
Mm-hmm.
So he would draw those kind of big picture things. He would talk about their past experiences and their parents' experiences and other close people that they know and how they felt about that. And do they visualize that same outcome for themselves? Do they believe that that's just their genetic predilection? Is that just fate? They just got dealt a
Mm-hmm.
bad hand of cards?
Mm-hmm.
Or are they willing to maybe grab on to the idea that maybe I've got something to do with this, the way this thing's trending and this potential outcome? Maybe I have some power over this thing that I've kind of given up hope on.
That
So,
is awesome.
all these things are relevant to what's happening in dentistry today as our awareness grows and the association of airway to everything else. Those are big, expensive, time consuming, uncomfortable decisions to make, major lifestyle changes in some cases that we're expecting people to make in the middle of their crazy busy life, and their wife just got diagnosed with breast cancer and you name
Mm-hmm.
it, XYZ. You're expecting them to just jump on board and follow your first suggestion on what to do and how to fix everything in their life relative to dentistry. Is that a realistic thought? I'm saying not really.
No, I don't think so.
So but is
What
it
we
is
keep
it a
expecting
is
is
it a
insanity.
right? Is it a reasonable objective if we're every time we're connecting with this person, revisiting it and going a little deeper and discussing it a little bit more and figuring out a little place here where they can make an adjustment or there.
Mm-hmm.
And as we started this particular topic, getting the microbiome under control is easy step one. They can do that.
Yes.
It doesn't require a lot of time or effort. It just requires a little bit of commitment. And so we can do that now. That's the very cool thing. The common dental diseases of dental decay, gingivitis, periodontal are a choice. If people want, they don't know that's a choice until you've
That's
had that
true. They don't
conversation.
know. And it's a
But
tough choice.
that's an interesting conversation to say, you can choose out of this if you want. Would you like to know more about that?
Wow. our culture, it does not, it is a choice, but it's a tough one, because people are surrounded with junk food and
Yes,
mouth
there's no
breathing,
doubt. To a large degree, I was just on a phone conference with Emily Stein this morning, and she was telling me about a study that they just got back. They had done it with some veterinarians at a zoo facility, and they were using her products on seals.
I love seals.
And they found that when she was using her one particular product, Protectin, they were brushing the seal's teeth with Protectin,
Mm-hmm.
and they were able to completely eliminate gingivitis in this group. And I said, well, imagine that, gingivitis in seals. I never would have thought that.
Yeah,
And
me
she goes,
either.
and then the conversation went into, well, unfortunately, they don't just eat fish. The humans give them all kind of crap with carbohydrates in it. And so we
Mm,
have seals under human care with dysbiotic oral microbiome. So it's no matter where a seal humans go, we seem to go get in there and screw everything up with
right. Oh my God. Right.
with our dysfunctional ideas and concepts and products and stuff that are easy and inexpensive and this and that, and
Mm-hmm.
uh, you know, give us a little bit of dopamine when we want it.
Mm-hmm.
So it's to expect a patient to have a perfect diet that doesn't create dysbiosis in their body is another unrealistic expectation.
Yep.
So here we are. Emily Stein presents us with an alternative to the reality that humans are imperfect.
Mm-hmm.
So,
And that's
it's a
awesome.
huge opportunity, huge opportunity.
We should be, yeah, every dentist office should have these, and they should be giving them, have it in a huge bowl. And, it's to me, it's the most remarkable thing I've heard of in the longest time. It's so much better than fluoride.
It's a game changer. So it's going to take a while for the um, the mindset of our profession to accept it. She got the patent in 2018
Mm-hmm.
and went to some dental meetings and was just completely given a cold shoulder because dentists just couldn't accept what she had done,
Yep.
to the point where she just kind of said, I don't know about this whole dentist profession thing. I cannot seem to communicate well with these people. So she focused all of her time and attention on veterinary medicine
Mm-hmm.
and proved it worked in that realm, and then has circled back around to dentistry because of people like me and a number of others who are going, oh, wait a minute. Just
Mm-hmm.
because people were giving you a cold shoulder in 2018, 19 doesn't mean you've got a bad idea here. It means that we've got to approach this problem from a different point of view, because we dentists are very dogmatic little creatures. We like our little ways. We want to
Mm-hmm.
control every minute of every day so that we can get in and get out on time and not be too traumatized ourselves.
Mm-hmm.
And so every time we add some new something into our practice, whether it's a product or a piece of equipment or whatever, it creates a lot of upheaval.
Mm-hmm.
It creates unpredictable moments that screw up all the things that we value even higher, which is predictability and less trauma.
Mm-hmm.
So, um, and so Emily's product is a category destroyer, you
Yeah.
know.
Yeah.
So there's a lot of people in dentistry that don't want, for financial reasons, don't want her product to be successful. So you get into all of that
Oh my
laid
God.
on top of it.
You know, well, this is, so when decay rates started going down, right, in the 70s, 80s, what did our profession do? Oh, cosmetic dentistry. Rather than going toward the medical model, the oral systemic model that we should have been going toward, we go that way. And it
Well,
infuriates.
on top of that, what our profession did was it built out capacity in dental schools right at the time when there were too many dentists already because we were in a recession, and um, the marketplace couldn't absorb all the dentists. So the cosmetic dentistry turned out to be this magical
Mm-hmm.
thing that allowed them to do dentistry on people that didn't have damage per se.
Mm-hmm.
You know, the active disease,
Yeah. Yeah.
although you could say they had occlusal disease, you could certainly say that, but
Well, yeah.
you know, they didn't have to be repairing decay, and there weren't as many people to see that had that problem. All of a sudden, that this opened up the whole door of aesthetic dentistry and all the hype associated with that one. So
But now, okay, so here we are 40 years later, and decay rates they're back up. And but we have trained the public to look at us as estheticians. You know, when they shut New York down for the pandemic, dentists and beauty salons were in the same category. So
that's right. I mean, if had we just opened up maybe a little liquor store and a strip club in our office, we could have maintained profitability during that time. But few of us had that kind of foresight.
oh my god, but I'm speaking more to, this is where how we get categorized, and now you can get your teeth bleached in a freaking salon.
Sure.
So come on. So, not only have we devalued ourselves, but the public is, devalued us. And I just read an article this morning about basement dentistry, people who, you know think that they can provide dental care in their bathroom because how hard could it be?
Right. So, you know, and that's what happens to dentistry when it becomes depersonalized and everything's just about the procedure.
Mm-hmm. Yeah.
So, you know, when you disconnect the procedures from health outcomes or health goals or anything like that, or it becomes so reductionistic that don't have the sophistication to understand that X influences Y and Y influences Z, and it's a big loop
Mm-hmm.
of one thing influencing the other. Most people don't have the sophistication to understand that. They just understand that veneers are expensive. Why
Mm-hmm.
don't I just let Bob down the street, who's got a dental chair, who lost his license, do it?
Right. Right. Or order them off the internet. Order these.
Or order
They're
them off the internet.
yeah, they're basically like costume teeth.
Yeah.
Yeah.
So, I mean, yeah, I mean, one of the things that I think that we have inadvertently done is we've created the sort of impression that teeth are kind of disposable.
Yeah. Yeah.
So, I mean, it's somebody having a tooth extracted, you know, if we treated teeth extractions in the same way as like amputating fingers or
Mm-hmm.
toes, dentistry would be treated very differently.
Mm-hmm.
We wouldn't take decisions like that so cavalierly.
Mm-hmm.
I had a patient yesterday who's actually a radiologist at the local hospital, and if you want to talk to some really miserably unhappy people, talk to a physician or any kind of physician. Even the specialists are miserable right now because of
Mm-hmm.
what the medical system has captured them and is
Yeah.
ruining their life. But you know, we were talking about the relatedness of dentistry to whole health. And, you know, these are highly educated, smart people, and their understanding of that is pretty low. But he came in, actually, he had some recurrent decay under a crown that we discovered in a recare visit. And he had heard of a patient who ended up having a heart event because of periodontal disease, and boom, he was in the office the next day thinking that that could happen to him.
Wow.
So, you know, that kind of information is getting out there in the
Yes.
ether,
Yeah.
but it's primarily in the lap of us dentists to promote that. because most people can't put all those pieces of the puzzle together and understand how everything's interrelated.
Mm-hmm. I completely agree. And I hope that, going forward, that, dental offices in the future will be in the same building as primary care physicians. And, we'll be sharing information and collaborating. Um, it's funny how, like Hippocrates and, dentists 150 years ago had a much better idea of the mouth as a portal to the rest of the body. And then we kind of forgot, I think, because the technology just got so good, we were able to focus on, the teeth.
Yeah, I mean, I think the more knowledge we obtain, the more ignorant we become in a certain paradoxical way, because we tend to lose focus on the whole. We
Yes.
tend to focus on the trees and not the forest because there's so much to see there, so much to do there now. We know how to, I mean, we can diagnose and do so many more things in the oral cavity now than we could have ever imagined 40 years ago.
Mm-hmm.
That it's easy to get lost in that jungle and not back up and say, okay, how is this relevant to the whole?
Right.
And for example, there was a study done in 2015 in Japan, and they did progressive extractions on rats,
Mm-hmm.
and they tested them for memory retention. And the outcome of the study was the more teeth they lost, the less memory they had.
Wow.
Okay, so basically, there's a use it or lose it
Mm-hmm.
neural input to the brain from the teeth that influences memory retention. Oh my God. Did that now correlate that to people with dentures
Mm-hmm.
and, how many people that have dementia and Alzheimer's? What is their oral condition? We already know that oral bacteria do end up in the brains of Alzheimer patients.
Oh, yeah.
So, I mean, so all of this is interrelated. It's just our ignorance that is the barrier between us really knowing and realizing that. So we have to, that's the danger. As we get
Mm-hmm.
more and more focused, we get higher, higher and higher power magnification, and we get more and more sophisticated in bone grafting, and we're more and more sophisticated in all the other techniques that we have in dentistry, which are incredible, really, compared to where I started from.
Right.
We lose sight that even that's not remotely enough because the little thing we're focused on is connected to many other much more sophisticated things, and they're influencing each other in so many ways. So is it even possible for that to be revealed if you don't have a good relationship with a person who's giving you that information and the feedback about what you're doing, whether it's helpful or not?
Mm-hmm.
And every person is a unique situation with regard to the compromises they have, as well as how their body's able to adapt to that. And so pretty much everybody we're looking at is in some adapted form of health. Very, very
Absolutely.
few people come in our door and they're absolutely healthy in every way. They
There's no
may
such
not,
thing
right, they
anywhere.
may not be symptomatic,
Right.
but you're still looking at multiple adaptations
Oh,
to various
yes.
things.
Yes. Compensations and
So if you don't have that kind of mindset and curiosity to dig those things out, then you're just kind of chasing a black cat around a dark room.
wow. You know, yeah, so it's amazing to me, like, how are we even still alive when you think about it? I mean, when I was talking with Emily, we kind of came to this conclusion too, like, how are we even alive? How are we surviving? But we are. So, the human body's capacity for adaptation, for compensation, to get as close as it can to that homeostasis. And it's miraculous, really.
The body is an amazing thing. And I think that, and these are kind of conversations I frequently have with patients, is just about how amazing their body is. Look
Mm-hmm.
at what's happened to you and look at how your body has been able to successfully adapt to that.
Mm-hmm.
Look at how functional you are in spite of this.
Mm-hmm.
And so what we need to do is find a ways to support your body in doing what it wants to do,
Mm-hmm. Which is
not to
being
fight it,
well.
not,
Yeah.
yeah. And the body is just an incredibly amazing thing. And we need to start by just honoring that fact and getting the barriers out of the way so that the body can do what it wants to do. It wants to move on. It
Yeah.
doesn't want the person to be struggling.
That's
So,
amazing.
yeah.
And so I really appreciate you and all the people that I met through you. If it wasn't for you and going to that study club, I would never have met a whole bunch of people. So I'm really grateful to you. And I love the Bob Barkley Study Club. I love everything that you put up on Facebook. You inspire me on a daily basis.
Well,
And
thank you. I'm glad you appreciate that. My staff of 100 that puts those things up will appreciate it as well.
right. So I want to thank you for sitting with me this afternoon and taking the time to speak with me. And I wonder if Emily's ears were ringing while we were talking about her. And just thank you so much
All right.
for everything, for your influence and for your knowledge and your inspiration.
Well, thank you for everything you're doing to keep, advance the word, advance person-centered healthcare.
All right. Well, I'll look forward to seeing you sometime soon at a gathering.
All right. Sounds good.
All right.
Have a great weekend.
You too. Bye bye.
All right.